already consented to it. We are going to be recording this event because there's quite a few people that couldn't join us today because of summer holidays now starting, and we've agreed that we will share the recording. Hopefully that's okay with everyone, but if you do have an issue with that, please pop it into the chat. I think I've covered all the housekeeping. My colleagues, any other points I need to add? No? Okay, thank you. So we have a really packed agenda today. We have brought you all together to launch our project, which is about building social care research capacity in Kent, and we will talk more about what that project is all about and how you can get involved. We hope that this provides an opportunity for you to share your ideas, but also network with partners and colleagues. And it's an opportunity for us to think innovatively about how research can support best practice and improve outcomes for the people that we support. And what we hope is that we'll be able to discuss research priority areas that we can then take away and focus in on. So that's a brief overview of the event and what we hope to cover. We will have some breakout sessions in smaller groups where you'll have chance to discuss. There will be a comfort break at 3 o'clock. We are going to be joined later on today by Julie Davidson, the Head of Strategic Safeguarding, and who's also our social care principal social worker. And she's going to talk about the importance of social care research and the impact and improvement opportunities it presents. And then we will come back together for half an hour, just under half an hour, where we will reflect on today's session and open up the floor for any questions. Can we move on, please? So I am now going to hand over to Anne-Marie, who's going to start to introduce this exciting project.
Thanks, Gina. Okay, next slide. So my name's Anne-Marie Towers. For those of you who don't know me, I'm a reader in social care at the University of Kent, and I co-lead this project with Gina. Altogether, there are 6 social care partnerships like ours being funded in England. I won't go through them all, but you can have a little scan down there and see all the different ones and see there's quite a decent sort of geographical coverage. And actually, most of the partnerships like ours are combining different sorts of parts of the social care sector. So although I've only put the university leads just for ease and space, you will see that if you look at any of those up, that they are a partnership between local authorities and the social care sector. Okay, next slide. So the aim of the research partnerships as a whole is really to build long-term collaborations between partners. And by partners, I mean local authorities, social care providers, that might be care homes, but it would also be practitioners such as social workers, occupational therapists, registered nurses, anyone working in the sector. And very importantly, we also want to involve people who are using services and their informal carers. All of the different partnerships are using a co-production approach in different ways, and they're using that co-production approach to work together to prioritise what are the strategic research priorities for social care in their regions. So every partnership is taking that kind of slightly regional perspective, but as a whole, we're giving quite good national coverage. So the partnerships are using a variety of mechanisms to do this capacity building. There are things called research in practice models. There are communities of practice, and we're going to explain some of these in a minute. And there are also different ways in which universities are embedding researchers within social care organisations. And the main reason for doing that is that if you embed a researcher within an organisation, you're in a better position to really start changing the culture and providing some sort of support and expertise for people working and using services, and helping them build those skills and build that confidence to start thinking about how they can be involved in research. So next slide, please. A little bit about our specific partnership next. Next slide, Benji. This is our core team. So you can see Gina and I there, and then we've got people from KCC who you will be meeting in some of the breakout sessions later today, and then a team of people from both the University of Kent. We've also got the University of Brighton, and we've got our lay co-applicant, Mr. John Potts, who will be speaking later today. Next slide. And this core team is supported by a wider team representing the National Institute for Health Research. So we've got people from the ARC, the Applied Research Collaboration. Oh, sorry, could somebody mute? Thank you. We've got people from the Applied Research Collaboration, the ARC, who will be talking a little bit later about what they're doing in the area, and they're supporting this study. We also have representatives from the social care sector. So we've got Dr. Jane Townsend from the UK Home Care Association. She's joining us today and will be facilitating one of the groups. We've got Louise Faulkner, that some of you, particularly local people, might know, who is from Kent Integrated Care Alliance, or KICA. We've also got Liz Jones, who's Policy Director of the National Care Forum. Again, Liz is here today and will be co-facilitating one of our sessions later today. And we have Becky Dilley, who is a research nurse from the Clinical Research Network. So we've got loads of support for this partnership. So I'm going to hand over now to Gina, who's going to take you through some of the details of our particular partnership and what the opportunities are for you all.
Lovely, thank you very much. And I remembered to take myself off mute. I was like, don't forget to take yourself off mute. Don't be the one that does that when you start talking, everyone's shouting at you. Anyway, so just a little bit of detail in terms of the project. So it's a 4-year project that officially started from June this year. And there are going to be 4 key work streams within this project. So the first one is around communities of practice. And I'll give an example later on, but communities of practice are networking opportunities, network events where we bring together people with a shared interest who can explore and share good practice, discuss and deep dive into particular topics. Sorry, it's the having doors and windows open with the summer and you get the wind blow and then doors suddenly slam. So apologies for that. So yes, those communities of practice comes together to explore topics, agree priorities, goals, and within those start to develop those ideas, which then could turn into research projects, which could secure further funding in the future. So that's an opportunity for you all to get involved in, because those communities of practice will be open, and they haven't started yet because we've only just officially started this project, and communities of practice are a concept that will start to build up as the project progresses, and we will have communication channels so that people know when we're about to start to engage people to bring them together to start to form those communities of practice. The community of practice will be very much self-led in terms of agreeing the way that those communities of practice will work and how they're structured. We will just provide a facilitation support role in that, but we will really look at those key research priorities in Kent and start to share good practice and deep dive into those topics. Workstream 2, research and residents. This is really exciting opportunity, both for the University of Kent, but also for adult social care in Kent County Council. We're looking to recruit 2 research and resident posts. So one would be based within the University of Kent, and the other one would be based within adult social care, but working across the organisations and having the opportunity to experience working in the different organisation. So if we have a researcher in residence that is within adult social care and has a social care background, the really exciting opportunity for that person would then to be able to experience the academic side of research and being based within the University of Kent and being supported. And that would also be then the same for the person that would be hosted by the University of Kent, having the opportunity to come in and work within Kent Adult Social Care and really work closely with our operational teams and understand how it is to work within the front line and the delivery side of social care. The researcher and resident posts will work across all of the work streams, so they will very much support the community practice, help facilitate the communities of practice and the development of the project ideas that start to emerge from those community of practice, and look at how they can support those ideas to progress to become potentially pilot projects, which is part of work stream 3. And also help us build a research culture. So those researcher and resident posts really help us start to move towards embedding research within social care and starting to become a more researched culture. Social care is at a very different stage and point in research compared to health. Health has always been a much more research focused and supports those opportunities within the workforce, and social care has been somewhat behind. But there is now a real focus and support for social care research, and these researcher and resident posts will really help us embed that culture and share that learning. Workstream 3 will be looking at pilot projects. So the communities of practice will start to identify those project ideas. What will happen in Workstream 3 is that those ideas will be supported, and there'll be funding to make those ideas a reality and enable practitioners the opportunity to undertake a fellowship to experience first-hand research project and being involved in delivering that research project. So that funding will provide backfill for those individuals to participate within that research project and free up their time to be able to do that. The research fellowships will provide bespoke research training and opportunities to attend conferences and publication per project. And then there'll be Workstream 4, which is very much around us sharing the learning from this project, not only across Kent and across the sector and with the people that we support and the Kent residents, but also nationally with those other partnerships that Anne-Marie shared at the start of this event. And also for us to evaluate the impact of this project and consider how we make this sustainable after the 4 years and how we want to continue to deliver the elements of this that work really well and allow us to really embed that social care research culture. So a little bit more about communities of practice, because it's quite a new concept and new to social care. So we just want to provide an example around what a community of practice is. So this is one that Anne-Marie shared from some work that was done with a care home research project. So here you've got the community, so people who know about care homes, and when we say community, that could be people that are within care homes, it could be family and friends and carers, but also staff that are working within the care sector, coming together with practitioners, sharing their ideas and evidence of best practice, and agreeing on the priorities and learning that come out from those communities of practice. And what I've described in the slide earlier is about how we then might want to pull out those key points and potentially turn them into research projects and attract funding to enable those to happen. Next one, please. So the researcher in residence, there's 2 posts that we're looking to fulfill. One is based in the University of Kent, and the other one is within Kent Adult Social Care. The one in the University of Kent, there's 2 lovely people that have been identified. I don't know if you want to say hello, both of you. Wenjing, you can go first.
Hello. I'm Wenjing. I'm based at the University of Kent, and I will share the post with Raza as a research in residence.
Lovely. And Raza?
Hi everyone, I'm Raza, and I'll be sharing the post with Wenjing. What Wenjing hasn't said, which might be relevant to the post, is that Wenjing's a qualified social worker, and I've got 13-year experience of being a dementia care worker, which hopefully puts us in a perfect position to bridge the research and practice divide.
Yeah. Brilliant, thank you. Very exciting. So both of you will be sharing a full-time research and residence post at the University of Kent, and then we are about to recruit to the Kent Adult Social Care Research and Residence post. So we're looking to advertise that within the next couple of weeks. So for those of you that might be interested, I'm happy for you to contact me outside of this event, and keep your eyes out for the adverts. Okay, so opportunities and how you can get involved. So after today, we'll be shaping the plan for communities of practice, and share the information so you can look out for that and get involved and come along and share and explore your ideas. There will be training and opportunities to build research knowledge and skills throughout the project. There's also the opportunity to apply for one of the research and training fellowships. As I said, there's going to be 3 of those funded through this project. We're allowing up to 90,000 per fellowship, and funding will protect the staff members' time so that they do have the capacity to engage with the fellowship, and that they can build a small team to support them with their project. All research and training costs will be included within that, and there'll be an opportunity for those fellowships to attend a conference and open access publication. And what's really exciting about this is that this allows 3 ideas to be made a reality and test them and undertake a research project around them. There will also be access to online resources and research informed practice events that we will be opening up to our sector and our workforce and people that are involved. And this is just a disclaimer which we have to legally include. Okay, I'm now going to hand over to Becky, who's just going to give a little bit of an overview of the Applied Research Collaboration for those of you that are not aware of this.
Thanks, Gina, and hi everybody. Great to be part of this event today. So I'm Becky Sharp, and I'm the implementation manager for one of our core themes of the Applied Research Collaboration, or ARC, as we tend to call it. And the ARCs are basically a network of 15 collaborations covering all regions across England, and it falls under the umbrella of the National Institute of Health Research to offer basically a new research infrastructure. And it's one that develops sort of regionally based research partnerships and bridges the gap. The aim is to bridge the gap between academia and research and practice. So includes, as well as providers and local authorities as member organisations. We've got health organisations and NHS trusts, but also important that we also involve sort of frontline practitioners as part of that work and our service users. So just conscious of time, but very quickly, we have 4 core research themes within our ARC, basically developed as priority areas for the KSS population. So there's social care, primary and community care, dementia and ageing well, and also CYP mental health. And it's probably also worth noting that under the leadership of Professor Julian Forder at the University of Kent, ARC KSS are also leading a national consortium for research in social care and social work. And I think that really reflects the strength that we have in research in this area in Kent and Surrey and Sussex. And I think we're used to seeing sort of and hearing about a lot of research in healthcare, and it's great to see that research in this sector, in the social care sector, has started to really gain traction and momentum. So just onto the next slide, please, Wenjing. You'll see from this slide that the aims of the ARC have a lot of similarity and synergy to the Kent Research Partnership that Gina has just outlined for you. But we're working across the region and not just in Kent, and also with our wider national network that I've mentioned. So we can sort of bring back that sort of shared knowledge and learning to Kent to support the partnership, but also importantly feed the excellent work going on in Kent for wider implementation, both regionally and nationally too. One area to mention as part of the capacity building that you see on the slide there is that ARC KSS Academy, which aims to support early career researchers, including practitioners. And we often release small grants for individual development awards, and there's a couple that are open now, and we'll be really pleased to receive applications from practitioners, and we can obviously share this with you, more details of this with you. And also just to say that, led by Dr. Jolie Kamink from the University of Kent, who's running one of the breakout sessions today, the ARC is also currently running a research priority setting exercise across the region, and developing communities of practice. And that's why it's really important for us to be here today and be working with the research partnership in Kent, to sort of support each other, make sure we're not duplicating, and also, you know, feeding into each other's work. So with nothing further to say, I'll hand over now to Anne-Marie. Thank you.
Thank you. Right, I know that's a lot of information for you all, and I can see that there's some links going into the chat for those of you who want to find out more. I think rather than take questions at this stage, what would be more useful would be to us to allow enough time for people to really engage and have their breakout sessions, because you'll get an opportunity to really give your views and flesh out things within those breakout sessions in a way that might be more difficult during a Q&A session. Remember, if you do have questions, you can put them in the chat, and you can put them in the Slido link that was shared at the beginning of the session. So the first breakout session, what's going to happen is you're going to be allocated to a room. We try to do this in a sensible way ahead of time by looking at who you all are and what your organisations are, and matching you to researchers and practitioners in a sensible way. Obviously, as with all these things, what's happened in the background while we've had the first presentations is that we've been looking, and the list of people is different to the list of people who originally signed up. So there's been some moving around. So just for the benefit of facilitators listening to me now as well, some of Alan has actually reallocated some of the rooms in a sensible way. So you might find that you're actually, two rooms have been blended. And we've tried to do that in a way that makes sense. So once you get allocated to a room, can I just ask that facilitators in that room sort out who's going to record and who is going to do the main facilitation, talking about the questions, and where there's more than one team member, I suggest the other person takes notes. So good luck with your sessions. The first session is just to think about what are the key research priorities for you in adult social care in Kent. You're all going to come at this from a different perspective. Some of you work in the sector, some of you might be using services, some of you might be caring for people who are using services. Some of you will be outside of KCC, maybe you work for other care providers like care homes and day services. Some of you will be social workers, occupational therapists, and so on. So you're all going to be coming at this from a different perspective. And our job today is to try and to listen to you, make notes about what your views are about what's important. And we're going to be using that information to try and formulate those communities of practice so that we can bring you all together in the autumn. So take the opportunity to give your views, enjoy your session, and we'll be coming back together in half an hour, and then there will be a short break. All right, thanks everyone.
Okay, so I'm just about to open the breakout rooms. You might have experienced some strange kind of disruption to your screen or your Zoom connection, but just stick with it and it should put you in the right spot. Anne-Marie, I've put you in room 2 and distributed the other people from your breakout room. Okay.
of the proposal for this research project, and my key role is to ensure that the public are truly involved, that we question them, we seek input from them, and also as a lay representative, I will be working very closely with Gina in that area, and of course all the other members of the project. So thank you. Georgina, I think she's already introduced herself. Yes, so thank you. Can we have the next slide, please? So what's important about public involvement and engagement? Well, public involvement is absolutely key in everything we do. And in research, it's particularly instrumental in improving the quality of research projects. And many, many people I've spoken to have reinforced that point, and the strengthening and relevance of the impact. So that's why it's important. What's in it for me? Well, people involved in research projects have unquestionably gained from them. They've reported that they have felt empowered to contribute to society. They've gained new skills and trained as appropriate, and we're provided with a mechanism to share their experiences of working as part of a really strong and moving forward with the team, whilst influencing change. So we really will be looking forward to encouraging as many people as possible to input to this project. We will be using local and established networks, and my local role as chair of my PPG also will ensure that all the other PPGs across Kent are made aware of this project and fed information from it, and where we feel we can benefit from getting things back, we will seek information from them. So thank you. Next slide, please.
Thank you. So the reason we're going through this is that for this project, we're really keen to establish a social care working group consisting of around 8 to 9 people with lived experience of social care, for the reasons that John has just explained. This working group will work across the project, covering the key areas that I set out earlier on today. So that's informing the research priorities for the Kent Adult Social Care, contributing to the communities of practice, which is the interest groups that will come together to share ideas and look at best practice, providing input into the research projects, reviewing and contributing to partnership funding applications, and assisting with evaluation elements of the overall project and the impact, and how we then share that in terms of the wider communication. So really key to the project and that working group. Once the working group has been established, that group would agree how it will work and how often it will meet and how it will meet, subject to restrictions. So that could be virtually or it could be face-to-face, depending on if there are any restrictions. But it'd be very much down to that group to agree the terms of reference, how it would like to work, the frequency in which it would like to meet, and how it would like to meet, and how the meetings will be managed for the duration of the project. As I said earlier, it's a 4-year project, but absolutely key that we have a working group with people with lived experience to help us shape and deliver this project. People will be paid for their time and expenses, and training and support will be offered if people feel that that is required. So what we'll do after today is send out a flyer which summarises what we've just gone through. So if you are interested, please get in touch. Here's our email address, or give me a call if you have any questions or if you'd like to put yourselves forward. We're using today to kickstart the recruitment to that working group, and there will be a lot more information in terms of ongoing communication and flyers that we'll send out to networks asking for people to be involved. But if you are interested, please follow up with us. I'm now going to hand over to Lisa Clinton, who is from our stakeholder team. Lisa, I'll let you introduce yourself and you can talk about the importance of person's voice in social care.
Thanks, Gina, and thanks, John. I'm Lisa Clinton, Stakeholder Engagement Manager for Adult Social Care and Health at Kent County Council. I work really, really closely with Gina and her team. And what my team are there to do is actually just to embed the person's voice in everything we do in adult social care. We're a relatively new team. We came into being this time last year. And we've really noticed, I mean, I've been working in communications and engagement since 2005, and I've really noticed now, there's a real commitment and there's a real push to maintaining the person's voice at the top of the agenda for social care, which is really encouraging. We've got a lot of work to do to make sure that we are following best practice, that we're giving those opportunities and we're promoting those to lots of different people in Kent of all backgrounds. So on this slide, it just gives you an overview of what we're doing in adult social care at the moment across the whole piece. And we do have regular reference groups. So we have members of our People's Panel here today who give their feedback on a regular basis and who help to really shape things that we're doing. We also have Learning Disability Partnership Board in Kent, which is fantastic because not every local authority has one of those. So that's really great to get the lived experience and the voices through at a decision-making level as well. We run stakeholder interview panels. So that's where people, members of the public, people with lived experience actually help us to recruit to to all levels of posts now actually across adult social care, so that really they do have that immediate feedback during somebody's interview. And we're also looking at doing a lot more virtual co-production events. Namely, we've got the strategy co-production events coming up. We've started that already earlier on in the year, and we're continuing the conversation about the adult social care strategy from the 2nd to the 13th of August. So if anyone is interested in any of those things that are listed up on that slide, please do get in touch with me and my team. I can circulate contact details afterwards. But we're doing a public campaign at the moment to reach out to as many people as we can from all different backgrounds across Kent and just keep them informed, engaged, involved, and able to co-produce with us. So that's just a very quick roundup of what my team are doing at the moment in partnership with Gina's team. And obviously your voices are extremely valued in terms of coming up with ideas, suggestions, and innovations of how we can move forward with social care for the future. On the next slide, there's actually a few quotes from members of the public who have been involved in some of the things that we've done already. And as John said earlier, it's a really enriching experience to get involved in some of these working groups, these panels. We all learn from each other, especially from experts by experience. But actually, it's a two-way thing, and actually, people have found their own networks, their own connections, and their own opportunities to work together. Regardless of adult social care involvement. So it's been a really, really positive thing to be involved with over the last year, and we hope to continue to do much more of that good work together. Thank you for the time, and please do get in touch if you need any more information.
Thank you, and we can circulate after this, Lisa, the flyers and the promotional material that's been developed for the Your Voice campaign. And you may see some of the team visiting libraries. We're going out and about, which is a really nice part of the job, going out and talking to people. So we're doing a roadshow, a library roadshow over the rest of the summer, where we're rocking up to some libraries across the county and talking to people about their understanding of social care, what they think social care is, and then some of their experiences, and then we're using that to help inform how we design our social care moving forward. But as Lisa said, really important to hear your voice, and also as part of this project. Now Julie is in the process of joining us. Julie, are you with us yet?
Yes, Gina, I'm here.
Oh, brilliant. It worked well. So I'd like to introduce Julie Davison, our Principal Social Worker and also Head of Policy Practice. You've got a very long title, Julie. I'll let you introduce yourself, but Julie's going to talk about the importance of social care research.
Thank you, Gina. Thanks, Gina. Gina's right, I have got a very long title and she did an amazing job of nearly remembering it then. I'm Julie Davidson. I'm Head of Strategic Safeguarding Practice and Quality Assurance. And most importantly, I'm the Principal Social Worker for Kent County Council Adult Social Care and Health. So thank you, first of all, for the invitation to this really exciting opportunity that we have here in Kent. I wanted to just share a couple of thoughts, and I particularly like this quote. I think it gives us a really fortunate method of thinking in terms of the field that many of us on the call today work in. And for me, we are fortunate to work in a field which continually evolves and changes. And I think this partnership really provides us with a key opportunity to drive that agenda forward, both for our combined workforces, but most importantly for the people of Kent. If I can move us on, next slide, please. Thank you. Of course, the challenge with any research is making this relevant and harnessing this opportunity for our staff. And really thinking about the focus on both what we already know, we're rich in terms of our professional knowledge, but how we then integrate the research knowledge that I'm sure this project is going to generate and really creates the widest circumstances that enables research to really embed and shape our work going forward. Inevitably, though, there are challenges with using research and thinking about how, when, the way in which we use that. And I realised as I was preparing for this today, I've missed a critical additional point here, and my apologies. What I omitted to say is we need to absolutely get the right people involved in our research, using the best experts to shape the work, to inform our work. And for me, often that is critical in terms of listening to the citizens of Kent, who are the people that are in receipt of our services. And we absolutely would be remiss in not doing that here. But in thinking about research, finding the right information can often be a challenge, and really honing into in this internet-driven world, which is full of information, that opportunity to really think about what is it we need to know in Kent and how can we find the very best information, resource, support, and to interrogate that information. So again, thinking about weighing those opposing views that often research has, and there's richness in that, and that's important, but how, as both a practitioner and citizen, do we find our way through that history, and absolutely getting that right information. It's complex, it's complicated, but I really think here together collectively we've got a huge opportunity. So that is all I was going to say. It would be really helpful to have some of your thoughts. I've heard that there's been some amazing ideas generated. So if you would indulge me for a few minutes, it would be fantastic to have a little of that shared with me.
Thank you, Julie. Really, really good. Thank you. So this is the first time we've opened up the floor to the whole of the virtual room. So far we've had breakout discussions, and we do have a virtual area where people can post their questions. So we were going to cover them at the end, but we do have a couple of minutes if anyone does have a burning question or point they'd like to share with Julie now. If not, you can continue to pop them in the chat or on the virtual parking lot where we're capturing all your comments and questions, and we can feed them back to Julie if there are any points that you wanted us to. But chance if anybody would like to ask a question now. I can't see any hands up. I'm just having a look across. It's a Friday afternoon, it's hot. Oh, I can see a hand. There's a hand. Right, let's have a look. Whose hand is it? Sorry,
I can see Liz.
It's me. Thanks. Well, we had some interesting discussions in our group a bit earlier, and I think the real challenge for all of this is how we avoid kind of projectitis and pilotitis. We have pockets of brilliance and things that are, are funded for a little while and do have fantastic outcomes. But then it's that embedding and that sustaining, really. So I guess that's a kind of shared endeavour, isn't it? It needs resource, it needs support across the sector, it needs training, it needs peer support as well as commissioner support. So just your reflections, really. Thank you.
Thank you, Liz. I wish I'd just left at that point then, because that's an enormous question, but really helpful, because I think I live in Kent. I've worked in Kent for a very long time, and I like that phrase, projectitis. And I think, as you absolutely say, some of this is in our gift, and some of the challenges that we have around funding, resources, etc., perhaps a little outside our gift. But I think what I know of the professionals and citizens of Kent, and I think what we've learned about ourselves in the last year, 18 months now, is Kent is an extraordinary place where, with shared will and endeavour, we can do amazing things to support each other. And I think really pushing into how we reshape our county's view of itself and what's important to us as a county provides an incredible opportunity. But I do take the point, projectitis is a danger, and we need to guard against that. But we also need to look into thinking quite differently and radically, and really tapping into what we've learned around what we can do collectively. And sometimes that doesn't involve money and resources. It involves just thinking differently, working differently together.
Lovely, thank you very much. So that has nicely brought us to 3:30. So I'm going to kick you off now, Julie. The nicest advice.
Sophie's just popped her hand up. And
sorry.
I can see she's been offering some support in the chat, which is, I always like a volunteer.
Yeah, sorry.
That's okay. I was just wondering if the research being done here is going to be fed into sort of the national social care reform that we're hoping happens.
Gina, I think that's probably one that you are much better equipped to answer than I am.
Yeah, thank you. Anne-Marie, I don't know if you're...
So the short answer for that is, well, that this social care research is going to last for 4 years. So, there will be engagement with policymakers, there will be engagement nationally through the different social care partnerships that are happening. But as with all research, and this is, I think, a challenge always for the sector when working with researchers or conducting research themselves, is the timescales are slow. So I think we have to see this as a bigger picture thing, rather than feeding into any particular immediate policy reform that's happening now. I think we have to see this as what it's all about, is capacity building. So how do we change culture? How do we, like Julie was just saying, how do we make changes now that's sustainable over time and will help address some of these issues over time, rather than seeing this as a quick fix and then it goes away. And we will engage policymakers. These are going to be the 6 projects that have been funded nationally are going to be very high profile. So I think there's going to be lots of scope for us to be influential. But what we will be doing is, through our communities of practice, is coming up with some regional solutions and some regional answers for us that we can then share through those networks. And hopefully we will also have the opportunity to learn from those other networks. And that's where I think we will have the biggest scope to be influential, by working together and across those different partnerships. Is that okay? Sounds like a cop-out, but I think we have to see this as a slow burner, but something that will actually have bigger impact long term.
Sure, thank you.
Mel, I can see you've got a question before we go to the next breakout.
It's just a comment on Sophie's question. I'll be very quick. And I think it's key that this partnership, and we're well placed with the national partners that are involved, both through the third sector organisations, but also through the research sectors, that hopefully the good things that are coming out can be, we really must make sure we feed those up through those already established partnerships and channels. So I think we've got good potential to make noise.
Agreed. Okay, I'm going to hand over to Sweta, if that's okay, to introduce the next breakout session.
And thank you, Julie.
Thank you, everyone. Right, just to introduce myself, I'm Dr. Sweta Rajan Rankin, a senior lecturer in the social work team at the University of Kent. And this breakout session is really focusing on advancing discussions we had in the first breakout around research priorities and getting us to think about how we can support practice-focused research in adult social care at Kent. And before we do that, I just wanted to briefly talk about communities of practice that we want to build through this project. Simply put, communities of practice are formed by people who engage in the process of collective learning around a shared area of interest. And what is really useful is a regional focus allows us to do that with clear solutions that can lead to two forms of knowledge exchange: how your practice can lead to research that's relevant and useful, but also how we can have research-informed practice that helps us to have best practice on the front line. So at this point, if we all go into our breakout rooms, we have till 4:05. Is that right, Anne-Marie? I think, yeah, perfect. And then we will come back into the main room for a closing session with Anne-Marie and Gina. Thanks very much.
Okay, again, as the first time, just going to start the process now.
There we go. So hopefully now you'll be able to see my screen. Okay, so thank you all very much. It's fast approaching, well, it is 4:10, so we are keen to conclude by 4:30 so that you can go and enjoy the rest of the day. So what we're going to do now is we're going to do a summary from the discussions from the breakout sessions. Then we'll open up for questions and then we'll summarise next steps. And I have to say, thank you all so very much for really engaging in your breakout sessions. There was lots of discussion and a lot for us to reflect on, which are going to really help us inform the topics that the communities of practice may want to focus in on when they start to come together. But what I would like to do is go to this slide here, which is a word cloud from session 1. So this here shows some of the key words from the discussions that took place as part of the session 1. When I had a look through the discussion points, the bits I pulled out was around the workforce and the impact. So measuring the impact on on services. Carers was a real key topic in the breakout sessions, and that's why the word there is larger. COVID, and looking at the learning during COVID, what did we do during COVID, and what the impact of that has been, and help inform how we work in the future. So some of the good practice, how we utilise technology during COVID. What else was there? There was around health and social care and integration, and the role of social care and the role of health, and being really clear on the services. Anne-Marie, I don't know if you've had a chance to.
just madly typing notes from my session
sorry.
2 as well at the same time. No, I think, I think what really came across for me in terms of the first session, so what we asked, if you remember, was what are the key research priorities for you in adult social care? And we wanted you to think about what those priorities were. And I think from the sessions that I was looking at earlier, I agree with you, Gina. I think there's a whole research topic, if you like, whether or not it ends up being a community of practice or not, I'm not sure at this point, but there's certainly a research topic around workforce. So around I think when workforce came up just now in session 2 as being a potential barrier as well, in terms of how do we engage people in research? So what support do you need to be involved in research? There was this issue around, look, if we're working in a sector where we've got high levels of turnover, we're really struggling with retention, we're maybe losing consistency and continuity where people are changing roles, even where you have a social worker, for example, they might end up being trained and then they move to a different part and you're losing some of that continuity, you're losing some of that expertise. So how do we keep people within the sector, and that being quite an important research topic, because there's a need to kind of learn from this and change the way that we work, but also in terms of how do we support the workforce to be engaged in research when all of that context is happening, which I thought was really interesting. So I think that came out as being really, really key. There was also in some of the groups I was involved in, there was a real issue around how do we move away from traditional models of care. So we're always talking about person-centered care. We're always talking about opportunities such as, direct payments and all of that sort of thing. But actually, are we just still following the same models, but just the funding's changed? So something around supporting the people who use services to be more directive, but also more creative about the care that they receive, so it really meets their needs. And in fact, generally talking about meeting needs, and how do we know as practitioners and from the workforce perspective, but also from the kind of informal care and service user perspective, how do we know that the care is making a difference and the support is making a difference to people's lives and to the things that matter to those people? So there's something here, I think, around measurement that cuts across. So it isn't just about which environment we're talking about, but how do we better measure the impact? And the impact, look at it right in the middle of that chart. How do we measure the impact that social care is having on people's lives? And I think that ties in with some of the themes that are coming out more broadly. So how do we measure it better? How do we support the workforce to deliver better outcomes for people? How do we recruit to the sector so that we keep really good people? How do we engage and support people to develop research skills when we're struggling to support them just to do their day jobs at the moment? And I think, so I don't know whether any of the other facilitators want to add to that from the discussions from the first stage. They're probably all busy typing notes at the moment.
Yeah.
I mean, in terms of, should we open that up to the room? I mean, in terms of this word cloud, does that ring true to a lot of you? I can see some people nodding when I was talking just then. Would anyone like to unmute themselves and add to the discussion here?
Oh,
Mel?
Hand up, Mel.
Yeah, hi. We talked a lot about in our breakout room about well, levelling up is a bit of a buzzword at the moment, but bringing care quality to a level, where the sector is, some may be providing less quality care, others more quality care, but using the outcomes and the quality of care as a benchmark.
Yeah. So kind of that, so yeah, exactly. How do we measure impact, and then how do we use that to compare and benchmark quality?
Just making, for those that receive services, equal access to good quality care, I think.
Okay. And in the group that we had was and it's quite large, the word carers. So carers, the impact on carers. There was a discussion within my group around young carers, but certainly a real need to look at carers in regards to how in Kent we commission carer services to do the assessment, and what's the impact of that? Coming back again to that word, the impact, which is large there. What is the impact of that way of commissioning and delivering support to carers in Kent?
Yeah.
Anybody else?
I mean, dementia is quite a big word that came up there, isn't it? And is COVID on there? I can't see COVID. Where's COVID?
Yeah, it is. It's COVID's on there.
Oh,
and then
yeah.
And the discussion in my group was around, well, what have we learned during COVID? What did we put in place during COVID? So think about things like technology. And one of the examples we discussed was around the video care phone Cara that we introduced within adult social care as a digital tool to help reduce social isolation and connect people with their services where there were restrictions. So really measuring the impact of what we put in place and how we worked during COVID, and what have we learned that we could then apply to our future way of working. Sarah's raised her hand.
Thank you. Hi, I'm Sarah from Alzheimer's and Dementia Support Services. We provide support across Dartford, Gresham and Swanley. I've just put in the chat group to everyone actually, just before you said this, so it's kind of worked out well. We did an evaluation study on the impact of COVID on people living with dementia. And there was also an element in that included their views on the adapted services. So we obviously had to do a lot to adapt: telephone welfare calls, virtual support groups, virtual singing groups, activity packs by post, all sorts of different things we were doing to try and keep people active and engaged. And what came back that was really interesting was people, whilst they were grateful that we'd been able to adapt so quickly to keep things going, there was definitely yeah, this is okay, but please don't please don't avoid the face-to-face services when we can do that again. There was a real clear want for those face-to-face services to come back, but also an acceptance that actually some of this virtual offer has a place as well. So if anyone's interested, please do, or someone's having a read already, please do have a read and enjoy. Yeah.
Thank you, Sarah. That's really good. And the other thing is quite, again, large, there's health. So the relationship with health, and in our group we talked a lot around, so what's health, what's social care. People still don't really understand the difference between health and social care, and they just sometimes know that they need support and need service, and that it's quite complex, the system. But also around hospital discharge, which has always been a hot topic, but even more so with COVID. And what does that look like? So what's the experience and the impact of hospital discharge? So people going into care homes and into their own homes, but some of the consideration around kind of their care and support when they're being discharged, and people being discharged with equipment, and it just really understand what that experience and impact is. And then being able to look at how do we better plan in the future for hospital discharge.
I wonder whether, because we've only got like 10 minutes left, I think we probably need a couple of minutes at the end just to tell people about what's going to happen next. We haven't had a chance, because we've not had a break. We've come straight from the last breakout to this session, obviously. We haven't had a chance to properly go through all the slides, but Wenjing has created a second word cloud. So of the session we've just had. So I don't know whether it's worth us just having a quick look at that.
Yeah, so I've just stopped screen sharing for that one.
I'll start talking.
Brilliant. Brilliant, thank you.
So yeah, I think something that's coming out is quite interesting, community. So I'm assuming maybe communities of practice came up as being a topic in some of those things about how, we asked in the second session, what support would you need to be involved in research? Time, look at that right there in the middle. And I think this is something we're going to have to think a lot about, actually. Don't forget, this is a 4-year project. And as Gina said at the start, we have got opportunities for you all to get involved in research and in different ways. One is to be part of communities of practice. Another would be to apply for these research training fellowships. And one of the things that came up in the session that I was in really strongly was that's great, and that's an amazing opportunity to maybe have some of your time funded through a research grant and be effectively bought out of your day job so that you can spend some of your time engaged in research. But is that realistic? And this came back to this idea of we don't have the time. It's not about the money necessarily, but about having enough other people to backfill your role, to keep supporting your teams, and challenges around that, which of course are much broader, aren't they? So I think some really, really interesting. Another thing that I can see on there is resources and support, and I think that ties in together, but something that came up really strongly was the idea that people would really love to have access to university resources, such as access to journals, so they can see the evidence and look things up really easily, and that's something that's dwindled over time, and that a lot of people feel a disconnect. And I did say, Gina, that we have costed in, don't know whether Sweta or Gina, you want to say something about that, but we actually did identify that, didn't we, when we were writing this proposal as being an issue. And we are going to try and make a lot of the journals available through the University of Kent to people involved in this work. So partners should be able to access some of these journals. Sweta, I can see you've unmuted. Do you want to say something about that?
Oh, no, absolutely. In our group, we talked about not just access to journals, but digestible and accessible brief databases of research, especially for people who are care workers or work in care homes, and of course, people who work in KCC and social workers as well. Not everyone understands academic jargon, neither should they. I think it's good practice for us to kind of demystify really important research and translate that. And we said we'd do that, didn't we, Anne-Marie, to create a sort of database of innovations and best practice around health and social care.
And I think what we said is that we thought that obviously there's lots of partners involved in this project, and we felt that actually it would be good to have some kind of resource that you would all be able to access, and that maybe Gina's team would be best placed to host that resource, so that it's really easy for everybody to access it and it's not siloed, but that we would link that to university resources to make sure there's a connectivity for people.
And it's not just exclusively then for people that are engaged within the communities of practice, that we share it across the county. One of the other things that came up in our discussion was around utilising the researcher and resident posts to do sort of that horizon scanning and learning from research projects, and about how they could then share some of that in a way that people can understand, so that we can consider how we can apply some of that learning back into our practice. Because that's a real missed opportunity. The one that we really don't utilise is there's a lot of research activity going on. We just, coming back to that time point, we don't have the time to look at that at that activity and apply the learning. So really good to use those roles.
Okay. I think we've got a few minutes left. Unless anyone's got anything burning they want to add, I wonder whether it's time to wrap up, and just, Gina, if you and I give people some next steps or something like that.
Yeah, so we just gone on to we just went onto the questions board, but what we'll do is, because of time, we will go back through the questions that you've put to us today. And we will answer them, and we will send out, following on from today, the slides, response to the questions, and also the summary from the discussions, and we'll circulate those to you all, and as I say, within that include a response to your questions. If you're really keen to get involved, our contact details are at the end of the slide, or if you just want to contact us for further information, or if you're interested in the research and residence post, or please do not hesitate to contact us. Anne-Marie?
Yep, so other things just to mention, we have set up Twitter for the project, and Raza has been manning that today, one of our researchers in residence who's working on the project, and I think Raza's going to put the Twitter handle into the chat, so that if you're on Twitter and you're active on Twitter, do follow us, because then you'll get to see updates that are shared about this project and opportunities that might become available. That will be another mechanism through which we'll share information. So those of you that use it, please do engage. And I think just to really reiterate that, you know, this is stage one. This is our first event. The project only started in June. So, you know, what's going to be happening now over the next few weeks is that we're going to be coming together, looking in detail at the recordings from today's session, the questions, and thinking about what these, starting to shape these communities of practice. And there will be a second event like this in the autumn, and we'll be inviting you all to come back for that. We'll be starting to come, we'll have had some ideas by that point of what these community practice might look like, and then there'll be an opportunity for everyone to discuss those and feed in and shape those, and we'll take it from there, really. And keep building on the feedback that we've received today, which has been incredibly useful. At least I've found it so.
Yes, yeah, no, thank you very much. And don't forget, if you're interested in joining the working group, please let John or I know, and also Lisa's put the link in for Your Voice network. But it has been really good and a lot for us to go through and think about, so thank you.
All right, thanks everybody.
And have a lovely afternoon and weekend.